Dr. Dumois, first of all, thanks so much for joining us again on 10
You're
News. We
welcome.
really appreciate it. I guess we spoke, it was probably about 2 months ago, the very onset of coronavirus in the United States. It was early March. There was concern because of its seriousness in China and in Italy and other Asian countries as it slowly spread here. The CDC put out guidelines, and this isn't that long ago. None of this is that long ago, but the CDC
Right.
put
A
out
lot's
guidelines.
changed. Yeah.
Yeah, a lot has changed, and I hate saying this, but it is literally changing every day, certainly every week. The CDC and the World Health Organization then endorsed these guidelines where they said you do not need to wear a mask unless you are sick. Now, the problem is I work in the news, so I hear this stuff every single day. 90% of Americans don't check in with a newspaper or a local news station or a network news station on a daily basis. So they hear, all right, I'm not sick, or I think I'm not sick. They could be asymptomatic, and they're told not to wear masks, yet they do have coronavirus, and they're walking around spreading this around everywhere. And then the CDC pulls a fast one on 300 million Americans and says, hey, listen, everyone's got to wear masks. What messaging are you getting right now? Now, at least we know we have to wear masks, but who's got to wear them? When should we wear them? What's the latest information that you are hearing?
That's a good question, and it's a complicated one. So I think the first thing I'd like to say about that is that we've learned a lot more about how the virus is transmitted over the last 2 months. And that is part of what led to the CDC making its change in the recommendations about wearing masks. It appears that this virus is relatively easily spread through the air, and that for somebody who has the virus, they could even potentially spread it by talking, not just coughing. So that makes it a little bit more contagious than some other respiratory viruses. So that is part of that's maybe one of the main reasons why the CDC changed their recommendation to say, it's probably a good idea to wear a mask most of the time when you're in areas where you cannot perform social distancing from other people. And there are a lot of out of your home examples of where that could happen if you're going to the grocery store or shopping somewhere else.
Right.
If you can do social distancing, it's not so important to wear a mask. If you're going to walk your dog in an area that is not really busy with other pedestrians or cyclists, there's really no need to wear a mask in those situations. On the other hand, if you're going to walk your dog someplace where you will frequently be passing other pedestrians because it's a park or some other popular outdoor area, and you should not expect that people will routinely do social distancing and stay 6 feet away from you as you approach them on a sidewalk. A mask may be a good idea in those circumstances.
Are you confused by the messaging that the CDC is sending down to the American people, and certainly people like yourself in the medical community?
Am I what?
Are you confused by the messaging? Do you think that 5 years from now, 10 years from now, whenever the history about the coronavirus is written and we have the ability to utilize hindsight, which of course is always 2020, do you think at some point someone will say, geez, the CDC might have botched that, and that move, not telling people to wear masks, may have cost lives?
I think it's certainly been confusing. And as you alluded to, many people who hear news reports with different recommendations on whether or not to wear masks aren't necessarily monitoring for updates every day. And most of them certainly are not going to the CDC website looking to see if they changed their recommendations today from what they were saying yesterday. So it's been extremely confusing. And then it's even more confusing when you hear other sources of COVID-19 information and recommendations giving very discrepant recommendations, whether it's from the White House or from our governors or other medical personnel who may be speaking online during an interview like this one and perhaps disagreeing with some of the other recommendations that we've heard. So there is plenty of source for confusion.
Do you think that the initial messaging, and this is apolitical, do you think the initial messaging about the masks was more based on politics because the stockpiles were low initially with masks? I mean, geez, we're telling people to wear bandanas and make masks in their basement now. Do you think that maybe some of the messaging behind don't wear a mask unless you know you've got coronavirus was more rooted in, hey, we don't have enough masks. We need to get these to the medical workers on the front lines and people that we know are confirmed to have had this case or have coronavirus?
Yeah, I think that the mask supply, the lack of an adequate mask supply was likely, and possibly we could even say definitely, a factor considered in whether to recommend routine wearing of masks. And that was, I think that concern was manifested in the way that stores ran out of masks so quickly near the beginning of the pandemic.
Right. Do you think that in March you said, and I'm not quoting you directly, but you said, generally speaking, if you're not worried about the flu, you shouldn't be worried about the coronavirus. Do you still feel that that's the general sense, or do you feel like that's changed?
Well, when I said that about if you're not worried about the flu, you don't have to worry about coronavirus, it was sort of a reverse way of saying you should really be worried about the flu as well. And many people underestimate the severity of the flu. Coronavirus does seem to be worse than the flu, however. It seems to be a little more contagious than the flu, and it's more dangerous than the flu in its ability to kill people.
I'm gonna give you some of the messaging that we've gotten out of the White House and out of Tallahassee. And this is going out to Americans. It just depends on the state that you live in.
Okay.
Do not leave your house, but leave your house if you have to. Don't go to the store, but you can go to the store if the store is open and you have to. Essential can mean anything. Wear a mask, but don't wear a mask if you are out in public and you're not in a crowded area. The messaging is, and this is tough for, and I do this every single day. This is tough for me to kind of sift through. Let's say that, and this is something that this might be beyond your purview, but I doubt it. My parents are up in the Northeast. They're in the Boston area where there is a massive outbreak, and it's the third highest number of confirmed cases right now, the state of Massachusetts, which is wild considering the population. You know, it's nowhere near the size of Florida. It's like a fifth the population of Florida. They think that because they're hearing certain messaging up there where it's 45 degrees and, you know, people are living on top of each other in places like Boston, that same messaging translates to a place like Tampa. And I try to explain to my mother, and this is based with no medical expertise, but just, you know, it's a much different situation. We're in a different climate. Is that accurate? America's a big country geographically. It can't be the same everywhere.
You're really hitting the nail on the head right there. I think that the best recommendations that we could give people would be distinct based on where they are. Because our geography seems to have something to do with the transmissibility of the virus. That it seems that you're going to see a lot more transmission in crowded areas, in areas where socially, not only are you going to be living with a lot of other people, but you will be commuting and just encountering other people as soon as you walk out the door, than in more sparsely populated or rural areas. We have evidence to suggest that temperature and humidity have something to do with the ease of viral transmission, as you alluded to.
Right.
And it would be best, in my opinion, if we could hear geographic specific recommendations for social distancing, perhaps different for big cities than smaller cities or rural areas. However, another part of the equation in figuring out, is it a big city or not, and is it up north in cooler climates versus the south where it's warmer and more humid, what is the hospital availability? Because one of the main reasons there are two main reasons that we're doing all this shutting down of things and social distancing. One is to protect the most fragile parts of our population, the elderly and those with weakened immune systems. And the other, since we can see bad COVID-19 in younger and healthier people, the other main reason is to not overwhelm our hospitals.
Mm-hmm.
So hospitals don't run out of beds, that they don't run out of ventilators. And as long as that is happening, that the hospitals are not being overwhelmed, then in some areas, it should be okay to relax restrictions. We know that the virus is not going to go away anytime soon. And that as you relax restrictions, there will be more transmission and there will be more cases. But as long as the local hospitals can handle it, then that's the main goal of restrictions.
And you would agree that, or you can tell me more about this, but there are, sometimes you'll turn on the news and if you catch it at the right moment, you'll hear that, a child was confirmed to have it, or a pet, or a 30-year-old has passed away. And are these more outliers? Because every illness, every virus, there are things we don't know in the early stages. So it's getting reported that a 30-year-old has it, or for example, but generally speaking, the messaging is still people of a certain age, advanced age, and then people with any pre-existing health conditions. And that, by the way, can be a whole lot of stuff. Is that correct?
Yeah, that is still valid to say that certain people are at higher risk of dying. But it can be a little deceptive when younger, healthier people think that if they get it, they'll be fine and that there's no chance that they could die. That is definitely not true. It's just that their chance of having severe COVID-19 and dying from it is much less. It is not zero.
Okay, I do want to get back to the masks, but while I have you, I have to ask you about this. In the early 1980s, the Surgeon General put out messaging that you could contract HIV from saliva, from kissing. And that same Surgeon General admitted a decade later that they had information then in the early 80s that is not how that virus was transmitted. But they needed to get the word out to the American people to stop sort of, I don't know if you want to call it, promiscuous behavior, but they just needed to get the word out to sort of flatten that curve then in the early 1980s. Did the same thing happen here, or was the messaging not strong enough, say, 2 months ago, late February, early March?
In retrospect, it certainly was not strong enough. And I think most people recognize that early recommendations from the CDC on whom to be tested were too restrictive and did not allow us to readily identify the extent of the outbreak in the United States. That's been pretty well recognized.
Right.
However, some of the other things that were being recommended, such as not wearing of masks, I think a lot of that can be explained by a lack of information at that time. We didn't have any specific scientific information on how readily this virus could be transmitted through the air. We were only getting sketchy reports and brief reports coming out of China.
Right.
And so, some of the messaging, based on what we knew then, could have been better, but other parts of it were limited by what we knew.
Yeah, and this is all still it's going to take a long time for us to ultimately have all these answers. But I think, Americans especially want to have the ability to blame someone or some entity. And I think there's finger pointing going around right now, and it might be a useless exercise. Okay, so you're at All Children's right here in the Bay Area, one of our fantastic hospitals. That means that you, doctor, are shopping at the same essential businesses that I'm going to, and that everyone that's going to see this interview is going to. I'll give you my day, just so this is as relatable as possible. I was at Walmart. I've got an SUV. I put my gloves on, my rubber gloves. I put them on in the SUV. I put my mask on. I go into Walmart. I'm doing all the shopping. I'm trying to read off my phone. I'm trying to get out of there as quickly as possible just because it feels kind of apocalyptic even just to be out of the house. I get back into my car and I take off my gloves and then I put all the bags in the car and then I hold the gloves in one hand and I don't want to put the gloves where I put everything in my car. So I put them on the floor of my car and then I grab my face mask off and then I feel like I've now cross-contaminated everything and this was a useless exercise. And then I go to the next place and I put that same mask back on. Are we just, I mean, I get that you have to use some common sense, but am I being crazy here or can I use the same mask twice? What can I do here? Because I think we all feel
I know that's the same. Yeah, it can make you crazy if you think of all the ways you can accidentally contaminate yourself if you
right.
make one misstep. And in a hospital setting, we try to be constantly vigilant of that. And ideally in a hospital setting, we would use our disposable mask and toss it and not even consider reusing it. But now with shortages, even hospital workers are having to consider reusing their masks for hours or for days, or at least trying to sterilize them for reuse. But going back to your scenario of when you're out in public, trying to bring your risk of exposure down to zero, that is very hard to do without proper awareness and training. So what you're trying to do really is decrease your overall risk and think about, if I'm going to get contaminated by the virus, where is that most likely going to happen? Is it possible that you could have some virus on the packaging that was handed to you by someone in a store? Yes. Are you as likely to get infected from exposure to that packaging as to something you touched with your own hands and then touched your face?
Right.
Packaging is going to be a lower risk. Or if you're in a store and you happen to be near somebody who happens to be coughing and they are not even wearing a mask, then you may be inhaling virus, and that's probably a higher risk exposure than carrying your bags out to your car. The person who's coughing but is wearing a mask is still a little bit contagious, but not nearly as much as the coughing person who is not wearing a mask. So you do want to protect yourself, if possible, from the people who may be near you and especially within 6 feet of you indoors who are coughing or otherwise contagious and talking, and maybe not worry so much about the lower level, lower risk contamination from the objects you may be carrying out of the store.
Right. Doctor, just a couple more quick ones. Everything is going to start reopening, and we knew it closed in waves. It wasn't a tidal wave; it all closed in waves. And now, as we're seeing, call them phases. There's 3 phases. There's my house doorbell. But things are going to be opening up in these 3 phases, these 3 waves, which starts really in earnest on Monday, May 4th. A lot of people are going to be sort of apprehensive initially about going to restaurants, bars, the beach, you name it. Okay, stores. What can people be doing besides using common sense and washing their hands and wearing those masks? What do people need to be aware of as we reopen and sort of, come out of hibernation?
I think that one way that people might want to consider how careful they need to be in general is, are they in one of these higher risk categories, or is someone with whom they're in occasional contact with in one of these high risk categories for dying of COVID-19? They may want to continue to do the amount of social distancing that they have been doing now, or at least as much as they can. Because if you live with grandmother and she's in her 70s and you bring it home to her, even if she's not leaving the house, well, then that's as bad as if she had been going to
Right.
McDonald's.
Right.
Or, well, if she's been going to any store or restaurant. If people are not in those higher risk categories and want to venture out as things get opened up, they should still realize that the releasing of these restrictions does not mean that the virus is going away. It is still there, and you can still catch it, and you will be more likely to catch it if you are in more crowded areas. So, for example, I would think that common sense might dictate that even if they started opening sports arenas tomorrow, I probably don't want to go to a sports arena with thousands of other people sitting next to each other or lining up to get in or to buy food with this.
Do you mind if I ask you about that while you're talking about the sports?
Yeah.
So the Bucs signed this gentleman, quarterback. He's won 6 Super Bowls. His name's Tom Brady. Do we see a football season this fall?
I think of a football season with fans in the stands without any kind of restriction of the number of fans would be dangerous and could lead to new outbreaks, or not just outbreaks. We've got a pandemic going on. We may see new spikes in the pandemic in areas where those sports events are being held.
And at what point, doctor, do we say, because I have this feeling, and this is, again, I just think that once people are allowed out, they're going to wash their hands. They're going to be as smart as we can be. And if we start to curtail this again, I'm not convinced that it's going to be as successful as it was the first time. I'm not convinced that Americans are willing to go back inside. And that could be totally inaccurate, but that's just a feeling. But do you foresee something where, let's say Raymond James Stadium is half full or a quarter full and everyone's got to wear a mask, something like that, some sort of hybrid NFL experience?
Something like that might be what turns out to be a valid compromise for events like that. Yeah.
When do you see us getting a vaccine for this? And Dr. Fauci, we've heard 6, we've heard 3, we've heard 12, we've heard 18. I think the fastest we ever had one was 5 years in the 60s. I can't remember if it was mumps or something like that, or measles, something. The HIV, there's still no vaccine. It's treatable, but so it's not like there's an end game on this.
Not yet. I think there are 2 things that can help us determine when this pandemic essentially ends. And one is having ready availability of a vaccine that can provide immunity to a lot of people who have not yet been infected. The second thing that we don't hear talked about as much is that eventually enough people will have been infected that they will have some immunity to the virus as if they had received a vaccine. And over longer periods of time, more and more people will get infected. So there was some recent data that came out in the last week that in New York City, 25% of people, whether they were sick or not, have immunity to COVID-19. They've been infected. The asymptomatic ones were not given a vaccine. One was not available, but they acquired it naturally. Some had no symptoms, and hopefully they have some degree of protection. We don't know that for sure.
Right.
As greater proportions of the population, 80%, 90%, have developed the infection, survived it, and now have immunity, we will see that there will be fewer people who are susceptible to get infected, and therefore the infection rates will go down naturally.
Doctor, do you see, and this is just the fact that this is an airborne virus, I think is scary, but I don't think people really quite realize that to a certain extent, there just is nothing you can do if it's airborne. If you live in a high-rise tower, especially a high-rise tower built before a certain date, you might have an individual air conditioning unit in your building, but there is a lot of shared air. That's why hospital, like the NICU, for example, that's why that's closed off, right? Those areas, the air is closed off. I mean, isn't it at some point there is just there is only so much that we can do as human beings?
That's true, and that's why proper recommendations from health authorities are not saying that our social restrictions are going to end the pandemic. They only decrease the spikes so that hospitals can handle the sick people. But the pandemic is going to keep going on because it is so easy to spread this virus. People are going to transmit it, and a lot of people are still going to get infected.
Scary stuff. Dr. Dumois, thank you so much. Honestly, always such insightful stuff. We really appreciate it. Stay
Those were
healthy.
very insightful questions.
Oh, well, thank you. Trust me, I could talk to you. Our meeting's counting down. We've only got about 4 minutes, but I could talk to you for 2 hours about this. So much. But I know that you've got some other stuff going on.
Yeah.
But thank you for making yourself available, and I really hope that we can catch up with you again.
Sure. Anytime I can schedule it.
Thanks so much. Stay healthy, and thank you for everything you're doing, Doctor.
You're welcome. Thank you, Rob.